Local nonprofits do so much for the community, and Desert Oasis Healthcare believes many of them are critical for your health. That's why DOHC has contributed significantly both time and money to many of these organizations. Today, we're learning about 3 of them, what they do, their mission, what sparks them, and how they're making a difference in the community. In addition to learning more about where you live, who knows, your heart just might get sparked, and maybe you'll be inspired to get involved and help as well. Welcome to The Pulse. Came to Find Food Bank to learn how this organization helps people in the Coachella Valley with such a critical need, food. For example, just last year alone, they distributed more than 18 million pounds of food. We're about to talk to the CEO president of this organization, Debbie Espinosa. Let's head on inside. Debbie, we are sitting here in this powerhouse Find Food Bank that serves 120,000 people a month. I'm gonna say that again, 120,000 people a month, meaning chances are me, you, everybody here watching knows somebody, right, that is impacted by this food bank.
Yes, in fact, I think one of the scariest statistics isn't necessarily the number. One of the scariest statistics is that hunger is one of the most hidden issues that a person or a family or a child will go through because of the embarrassment that they feel that they don't have enough to eat. Chances are you are working alongside someone that is not getting enough to eat, or there are children that are going to school and they have friends and they aren't realizing that they have enough to eat, and they just don't want to say anything. We have a couple of high school students representing almost every high school here in the Coachella Valley. One of the first things that they said was, I had a friend that came up to me and was asking, like, are you going to finish your food, or are you going and getting the free and reduced lunch today? Because if you're not, would you mind going and getting it? Like, I'm just really hungry today. I had enough to eat, but I'm just really hungry today. So if you're not going to use it, bring it. And then they started realizing after we educated them that, my goodness, they're going through food insecurity and they have been friends with them for so long. They had no clue. So we can look at the numbers, but when you look at the human element of what hunger is all about, that is what people are going through, and that is what we are not seeing sometimes because we don't know how to identify it.
I want to just make sure everyone understands the concept of food security. Very simply put, someone once explained to me, is just where you don't know where your next meal is coming from.
Mm-hmm.
And some of the people that are served here by Find, some come every month, others might just fall on a hard time, others just started during the pandemic. Will you explain some of the circumstances that lead people to Find?
We know that only about 2 to 3% every year are people that are homeless, which means that 97 to 98% of the people are working, they're living in homes. The problem is that with the skyrocketing costs in California, people may be working, but they're having a hard time making ends meet. They're wondering, do I eat or do I pay for my electricity bill? And potentially risk having my electricity turned off when it's 120 degrees outside and I'm a senior that's 70 years old on a fixed income. I am a child wondering, do I ask my mom to buy me that apple at the store because she barely was able to pay for gas to get us to the store? These are the choices that people of all ages are making, and it doesn't seem like it in the surface, because they have a car, because they have a home, because they are going to work, because they look like They may be nourished, but a lot of the times people don't realize that there's a lot of malnourishment going on because all they're eating are empty carbs that are causing obesity and type 2 diabetes rampantly right now in our low-income communities and especially our communities of color. So those are the circumstances that surround it. And that's why there's a lot of embarrassment sometimes where people don't want to ask for help or you can't see it because we don't know the signs that we're looking for.
So these are all volunteers?
Yes, they are. They're here every 2 weeks, and they're actually a residential community.
How often do you have volunteer opportunities?
We have volunteer opportunities actually every day. There's
Okay.
morning sessions, afternoon sessions in the warehouse. We also have volunteer opportunities out in the distribution sites, which we could always use help.
Did you hear that? They have help needed every single day, right? Yes.
Absolutely.
Okay.
Yes.
How long have you been coming now and doing this?
I've been coming for years. Before I came with another group,
Oh, that's so nice.
and then we started it at our trilogy,
Yeah,
and we come twice a month.
I love that.
And it's wonderful.
You know, I have to ask because there's so many nonprofits in the desert, so many places that need help. What made your heart connect to Find?
Because I'm very philanthropic and I love helping people that need help.
We were talking about the people like yourselves who are, you know, blessed to live in these communities, and some come and go, right, to multiple parts of the country. You are the people that really lift up this economy, and it's just beautiful to see you helping the people that live here year round that need that help.
Well, it warms our heart. I think we get more pleasure. We get more pleasure.
We know that a third of the people served by Find are kids. I was shocked to learn this, 90% of which are on free and reduced lunch, meaning come summertime, these kids don't get to go to school and get more meals, meaning their family just has even more to try to deal with during those few months. Will you explain how the summer in the desert really impacts the families you serve?
We see food insecurity rates go much higher for 10 weeks in the summer, not just for the kids, but also for the adults who are now taking their food and they are pushing it to their kids, and they will be the ones to choose to miss the meals as opposed to their kids missing the meals. What is that? How can we allow that to happen? We should not ever allow things like that to happen in America. We have so many resources, so much abundance. So to hear that people have to struggle for 10 weeks just because our economy changes, that's where us as our residents, the ones that live here all the time and the ones that travel, make sure that we take care of each other whether you're here or not during the summertime, because it matters. It really does.
How much of your people that you serve are seniors here at Find?
Well, we have over 20% are seniors. And remember, with our seniors right now, it wasn't just the pandemic. It was the double whammy of the Great Recession during the 2000 to 2010 crisis. So a lot of our seniors now actually lost a lot of their retirement that they had worked for decades to be able to earn. Then fast forward, now they're stabilizing, they're living out here. They were able to figure out how to kind of how to make it work on a fixed income. And then the pandemic hit. And then you know what happened with the stock markets again for whatever else that they had left remaining. So the last thing we want is for people to have to make the choice between food and all of those things that I talked about. We want them to stay in their homes, pay your rent, come to Find Food Bank or any one of the pantries and nonprofit partners that we stock and go and get free food to give yourself a little bit more income to pay towards the other things that you can't get for free. Our community thrives when our people thrive. So it is in our best interest to make sure that the primal needs of our families and our seniors and our children are taken care of by helping them through whatever means that we can, if we can give them free services and give them help.
I just want to touch on Desert Oasis Healthcare being such a big supporter of Find.
Oh, yeah.
But Find also is such a huge resource for the seniors, the clients that DOHC serves. Can you talk about that beautiful marriage between the two?
Oh, absolutely. You know, Desert Oasis Healthcare, their commitment to really being able to understand what health means and the expansiveness of what medical care needs all the way through nutrition and having access to healthy foods is phenomenal. They have been at the forefront of understanding that. I talk to my colleagues around the country, the other CEOs at other Feeding America food banks. They talk to their equivalents of DOHCs in their local areas, and they still don't tie food and healthy food together with medical treatments and helping patients thrive within the medical care systems that they have. For us, we've not had to really explain that to DOHC. They've known it, they have understood it, and when we have the conversations, I don't have to start at the basics. We go straight to the advanced of how do we solve the problems and how do we solve the problems together as partners. They have been investing in food distribution services for many years now. They're always one of our major sponsors during our telethon, which is our major fundraiser of the year that allows everybody in to make a donation, no matter how large or small. Always love the impact statements that they give during telethon to help try to educate people from DOHC's perspective on what nutritious food means to their clients. It's not just about financial support. They support as volunteers, they support as home delivery agents. It's when you see corporate social responsibility, medical, and food security all come together in one beautiful package.
The face of hunger is all around us, and it is a quiet struggle that people go through every single day. 120,000 people that you all know every single month coming here. So if maybe we could all just have a little bit more grace for the people around us and our neighbors, and the world could use a lot more of that.
Absolutely.
So,
Grace,
thank you.
compassion, understanding.
Yes. It was really eye-opening to talk to Debbie, specifically learning about how many people struggle with food insecurity silently, quietly, in the walls of their own home, embarrassed to talk about it because of the stigma surrounding it. It just is remarkable if you could be here to see how much food it's beyond expansive. It's awe-inspiring to see how much comes in. Donations are coming in actually as we speak. There's 160 distribution sites all throughout Southern California here, covering a 5,000 square mile radius. I say those numbers just to point out how much help is there if you need it, if you're somebody who would like to reach out to find, learn how they could help your family, or maybe you have somebody who has the time and the heart and the energy to give to help distribute all that food. Whatever the case is, reach out to Find Food Bank, the number right here on your screen. Livestream needs at least 500 blood donors every single day in order to be able to maintain a safe supply of blood to all of its 80 different hospital partners. Now, to put this all in perspective for you, they've been doing this for a total of 70 years, so it's no wonder why so much blood is needed. To better understand how these donor centers operate, I talked to Michael McDaniels, the director of donor recruitment. So what do you attribute this blood shortage? Since the pandemic, we are well out of it. A lot of life has gone back to normal, yet those numbers have not gone back to normal. To what do you attribute that?
A lot of it is work from home. So prior to the pandemic, roughly 6% of the US worked from home. That's now tripled to 18%. And some say for Southern California, that's higher than 25%. So we host 2,400 blood drives annually, where we could go to an employer that had 100 people, now they're down to 80 people, 60 people. It's harder to reach people now post-pandemic with this new work from home culture. And that's a huge hurdle for us.
Well, I know I was learning that, for example, you often would go to high schools, right? But then during the pandemic, school was not happening. You lost a lot of blood that you would normally get just from all that community outreach. Has it picked back up?
It has picked back up. I'm happy to report that Livestream is one of the few centers in the nation that is actually back to almost pre-pandemic young people collection.
That's amazing.
When we look at those numbers, 40% of our blood product comes from ages 25 and under. So many centers right now are only seeing about 10% of their product coming from that age group, but the community, especially here in the low desert, has really bounced back, and we are almost at 40% again.
It's amazing to see the young community stepping up. Also, now the LGBT community can be involved and give blood, which they unfortunately were not able to before. Can you tell us about that?
Yes, and as a proud member of that community, I'm happy to. So the FDA followed Canada's advice, basically what Canada did 2 years ago, and we've moved to a risk-based sexual assessment now. So it doesn't matter so much who you have sex with like it used to before, where a male having sex with a male couldn't donate blood. Now it is your sexual practices, your sexual health, and that's the same for all genders.
I don't know if people can, understand the direct result of giving blood in a center, how it saves lives. So can you tell us some of these emotional stories that I know are out there of where this blood goes, like where their blood will be going and how they'll actually be saving somebody's life?
One that comes to mind is 5-month-old Paisley. So when she was 5 months old, she needed an open heart transplant. That's incredibly scary as a parent, right? She survived because LifeStream blood donors provided 41 pints of blood. That's 41 people that came together to save this little bitty human that you could hold in 2 hands, right? I also think of Officer Whitson, the San Bernardino County Sheriff's deputy that was shot in the line of duty within 45 seconds of responding to that call. He used over 30 blood products and was able to survive. Blood is the key to modern medicine. So what I say to people that don't know how blood touches someone's life, 1 in 7 people going into a hospital are going to need blood. 1 in 3 men and 1 in 2 women in the United States will develop cancer in their lifetime. And if they're gonna fight that cancer with chemo and radiation, they're gonna need blood product. It touches all of us.
I know a big wind beneath your wings is Desert Oasis Healthcare. How does DOHC and that partnership truly lift you up?
Well, there's not many hospital partners that will even do something like this, right? So the awareness is first and foremost. Having a partner like them, also sharing the stories of survival, right? And being able to share with our staff and with the community what blood product does through Desert Oasis. So we provide almost 500 units a year to Desert Oasis. And then to hear what they're able to do with it and see their growth really helps us collect more in the community.
So I'm here inside one of 2 donor centers here in the Coachella Valley, and I learned that this service area averages 1 liver transplant a day. Just for a bit of context for you, a liver transplant usually requires between 50 and 100 pints of blood. Clearly there's so much need. I just wanted to help how I can. So I just finished giving blood. I have my bandage on. I'm hanging around here for about 15 minutes just to monitor me and eating some of my salted peanuts. I have to tell you, I'm not a big needles person, honestly, but they made it so not scary. It was a really comfortable experience, and we even had a little bit of fun, and you really know you're making a difference. I encourage all of you, if you can give blood, if you'd like to learn more information, go to lstream.org. You really can make a difference. Working together closely with LifeStream are Desert Oasis Healthcare's infusion centers like the one right here behind me in this immediate care facility. These centers play a vital role in making sure members get fluids, medication, or life-saving blood products through an IV. DOHC staff is full of professionals with a passion for what they do and the care they provide their patients. All right, let's go inside now and learn more about this great collaborative effort to provide the best care possible. Now, Desert Oasis Healthcare, it plays such a critical role for so many people here in the desert, and just offering this infusion center, these services for people. Again, there must be such gratitude from the DOHC family members that come here.
Yes, yeah, most of them are very, very thankful. They're happy. Like I said, we have some of these patients that are, frequent flyers, I guess, if you want to call them. They might come monthly, or maybe they come every 2 weeks, and they're just so thankful that 1, they don't have to go into a hospital setting for this, and 2, they're able to get it, and it's fairly easy. Here it's less stressful. It's kind of a one-on-one situation with them. We're more dedicated just to that patient. We don't have other patients in the ER that maybe need our attention more. We're able just to focus and give them that one-on-one attention and just make sure that their needs are met, and questions are answered, and that they feel comfortable during the process.
Yeah, I definitely noticed that, just how sweet and bubbly everybody was here. The atmosphere definitely less intimidating than, like you said, than a hospital. So I would presume it's so comforting to get to have a place like this during such a hard time.
Yeah. I had one lady, she's passed unfortunately, but she always said, if this is the one thing wrong with me, then that's okay. I don't necessarily want to come in, but you guys make it an easy, joyful experience for me. And so it was always something that kind of stuck with me even after her passing, because she would come about once a month, And then it got down to like every 2 weeks that she was coming in. And she was always just kind and friendly and just happy, even though she didn't necessarily want to be here. She was like, if this is all that I have going on with me, this isn't so bad.
So inspiring when you see people going through a hard time that still have that optimism, right?
Yeah.
It is inspiring. Vanessa, I know there's a very critical relationship between LifeStream and the blood they collect there, those donations. You're all very eagerly awaiting that blood to get delivered here. Can you explain that process?
Yeah, so the blood bank has donations all over the valley, but their main lab is located in San Bernardino, and they also supply all of our local hospitals along with out Imperial County up into the high desert, the Marine Corps base. So we're kind of battling per se for the blood. Obviously the hospital is going to get first dibs, but pretty much ever since those restrictions from COVID have been lifted, we're able to get the 1 to 2 units that we do request next day, which is just absolutely amazing for our patients.
Thank you for what you do and just the joy that you bring to what could otherwise be such a scary situation for people, but you feel that DOHC love here, and it's very sweet to see.
Thank you.
Yeah.
The last organization we're highlighting today is celebrating its 100th birthday. The American Heart Association has worked globally to combat the effects of cardiovascular disease and stroke. AHA's relentless pursuit of life-saving research, science, and innovation has put them at the forefront of making communities healthier, including our Coachella Valley. To show you how, I talked to Lani Gokiala and Mary Lee.
I'm so excited to get to have a conversation about the American Heart Association to really bring it down to the local impact level, because we were just talking about this. It is a huge global organization, yes, and some people just don't even know how it impacts them, if it impacts them. So thank you for being here today.
Thank you for
Talk
having
about
us.
this. It's a big impact for everyone here in the Coachella Valley.
Absolutely.
Something you said, Lani, was the American Heart Association is not a direct service provider.
Correct.
Meaning there's no, direct daily impact to people here in the Coachella Valley, like person to person, so they don't think it impacts them.
That's right.
And that cannot be further from the truth. Explain.
Yeah, sure. So when we ask people about the Heart Association, many times they don't really understand the work that we do, right? They know of the organization as a ginormous global
Entity,
yes. Correct. But they don't understand or realize how it affects them directly. So as an example, if you were to go to a hospital and you get treated, let's say, for a stroke or a heart attack or any kind of cardiovascular issue, how you are treated is a certain guideline. The hospitals follow a certain guideline for the quality of care. Well, those guidelines came about from the research that the American Heart Association funded of the best way to treat patients so that that level of care they receive is top notch, and that results that they get, meaning that the sooner they go home, the sooner they get to spend time with their families, is improved because of that research and that care that they're given.
And you also mentioned, for example, the local food bank, Food Bank.
Exactly. People wouldn't necessarily associate the food bank with the Heart Association, but we work with the local food banks because many of the food banks actually, when they receive funds, not product, but funds, they go out and purchase their own food to provide. And so they adopt what we call the nutritional guidelines that the Heart Association came up with, where they're buying healthier choices. As an example, rather than buying a tuna in a can of oil, they'll buy tuna in water because that's just a healthier choice for the people that they serve. And so there's a whole list like a 50-page booklet or something that has all of the guidelines that the food bank then follows as they're purchasing the food for their patrons.
It might be hard to explain to people why they need to donate. It is a lot easier and sexier, if you will, to say, donate here, show this, your donation will help this puppy, or your donation will help this ill person. Worthy causes, of course, but when you say your donation will help research, people are like, research? But just to bring this full circle and reiterate what you just said, to underscore it, the research the American Heart Association does informs the decisions at the doctors that everyone here in the desert goes to, the food banks. Mary, why do you think the schools?
Yeah, exactly.
Where do you think that misunderstanding made from people not truly understanding how the research impacts them comes from?
I think a lot of times people really want to personalize that, make it individual. And if you don't have direct experience with, cardiovascular health, stroke in your family, that you might not understand. But, to bring it back to like the Valley here, the food banks are, yes, we're involved with them, but the individual consumer can go to the store and they can walk down the aisle and they can see our symbol on packaging of products and know that that's a heart healthy choice. And so that helps, drive their buying and, to ensure that they're buying healthy products for them. I think Lonnie mentioned working in the schools.
Right, yeah. So, we always talk about, everyone has a heart, right? And so the work that we do really does affect everyone. And even when we go back to the schools and the youth, right, and looking upstream, we have a school engagement program where we go into the schools and we teach them about nutrition. We teach them about obesity, about staying active, about mental well-being. Little things that people don't think about the Heart Association being involved in. But, our vision is to advance the health and hope for everyone, everywhere, because we truly believe that every single person deserves the opportunity to live a healthier life and to have those much extended time, those precious life moments that they wouldn't have had we not done the work that we did on the backside.
And I know DOHC has been such a big champion of the American Heart Association. Can you talk a bit about that partnership?
Yeah, DOHC has just been incredible. And again, we can't do what we do without the support of the community, including sponsors like DOHC, right? And so DOHC has just been a pivotal sponsor of ours in helping us really have that outreach in the community, doing programs to reduce hypertension, right, with self-monitoring or self-measured blood pressure control programs, really looking at nutrition insecurity, right, and helping us to work with the some of the senior centers, right, because again, that's another population that we reach, and that's really important. We also have done work with the schools in the Palm Springs Unified School District, right? And so all of that would not be possible without the help of DOHC. And so they've been just an incredible partner of ours as we work through, through our work out here in the desert. So.
Well, I know that support is so important. Again, you have this global organization, this research that essentially informs so many day-to-day interactions that we all in the Coachella Valley have with our doctors, with hospitals, with food banks, with schools. There, with our groceries, right, in the grocery store, decisions that AHA is making based on research that informs the, and develops the communities that we're living in. So it's important, I think, for people to understand that there will be a time when you need the guidance that comes from the American Heart Association. So pay it forward, because someday you might need it yourself, right?
Yeah, that is true. You just never know, right? Hopefully not, but again, you never know. And if not, you're going to be helping someone, right? And so, yeah, I think it's just important that we, there's so many ways, again, that we touch the community, which is why we do need the support of everyone out there.
Someone once told me that we all have 3 things we can give a nonprofit: time, treasure, and talent. So time, volunteering; treasure, money; and talent, some unique skill. So if watching this episode of The Pulse, learning about any of these 3 nonprofits sparked your heart, or there's so many nonprofits in the Valley, so if there's any other nonprofit here in the desert that you kind of have an interest in, or you feel a little something in your tummy when you see a commercial about them or hear about the work that they do, reach out and ask how you can help. I promise you that they want to hear from you. And if you don't know how to help, if you're a little, afraid of being the new kid, just send a simple email, phone call saying, "I'd like to help, let me know how I can." And I guarantee you, your life will be changed even more than all the people that you're going to be helping.